Luton is a marmot town. What that means is that in terms of tackling inequalities, there are 6 policy areas. Understanding how the social determinants impact on our health. Part of that is about the built environment, accessibility, being able to have control over your life and having a decent wage and being able to get to places. Marsh Farm, it was built in the 60s. We got new deals for the community to regenerate the place, and some of the flats got done. Beautiful flats today. We know that there's been improvements there. The biggest benefit that the HIA did, I feel, was to bring communities together and enable them to talk about development. We spent a lot of time master planning, thinking about development, thinking about safety, thinking about the children. For me, it's lifetime buildings, future-proofing and understanding that somebody may live in a home, especially now, all your life, have your children, and you need to be able to convert that home. So why are we not making sure that you can access the kitchen and that ventilation exists and that your heating is appropriate, and separate space for adults is so needed. It's about how you design it so that people feel included. Marsh Farm, we thought it was great at the time because it was young people could play, it would be lit up in the night and you could play football. The noise it created was horrendous. And so years down the line, people were complaining it's too noisy. So looking into the future is difficult. But, the people that are doing it, we have the best intentions and do try and use the best evidence as what is available at that time. How do we monitor effectively? We've not cracked this very well either. So the Marsh Farm HIA, which is for me the diamond in the crown, because it was a comprehensive HIA that we did with 2 external consultants. And some years later, a colleague asked us, "Has things changed, Chim?" And it was really hard to answer because we hadn't monitored it. We hadn't reviewed whether we'd really made the difference. We could do it with the sort of sense checking and go back, but really we're not very good at doing that. And I think that that's one of the areas we need to be stronger at. And if I had an ask, I think the kite mark or a collective of us needs to be held account and said, yeah, come on, you need to monitor this. We'll help you and we'll support one another in making sure that it's monitored. As long as you've got that senior level buy-in, that mid-level buy-in, your director of public health understands it, is engaged, you will fly, because you need somebody who can help you create that joined language and translate it and turn it into something that's meaningful. And then you can start influencing and be sitting in those early discussions. Because in truth, when it gets to planning applications time, it's way too late because it's determined. So you need your best mate planner who's going to help you open doors. So I've had the opportunity to sit in rooms with developers, and many years ago, I felt quite intimidated. Often you're asked too far down the line, so you can't influence in the way that you want to. Tips now I would give when I'm sitting in the room is to own your space and understand that you actually do bring something. Don't be afraid to speak up because there'll be a lot of technical talk, but at the end of the day, you keep in mind why you're there. Luton works because of the passion that's up, top down and bottom up. I think COVID has been instrumental because people have understood that health is wealth, it's a commodity. You cannot build something and then miss a big chunk of the population because you've not thought about what the health effects are of your development. And we have got so much to do in Luton.